Good morning, Coal City. Thanks for joining us on Matters of the Moment. Our last segment of our breakfast show, Good Morning, Coal City, right here on ESBS Sunrise FM 96.1. And today is May 29. I mean, it's a Wednesday. But for now, it used to be Democracy Day, but now we just observe anniversary of each administration. And for today, it is for the government at the central 1 year anniversary, and for most states, especially those who joined during the 2023 general election. So it is the anniversary, the first anniversary for most. May 29 is the 149th day of the year 2024, and 216 days remaining until the end of the year. Today, we have the privilege of hosting the Special Advisor to Enugu State Governor on Health, Dr. Yomi Jaye. Good morning, Yomi.
Good morning, viewers at home and in the Enugu. I greet you.
My name is Mbah, and I'm anchoring this segment with Chioma. Hi, Chioma.
Hi, good morning, Go City. My name is Chioma Agulana.
Governor Peter Mbah's first anniversary is still ongoing. I mean, we've been doing this week long, but our focus today will be Enugu health sector the last 1 year. And so, Doc, how has it been the last 1 year? I know you didn't take office at the same time with the governor, but then you've been the special advisor as long as the administration has lasted. So how has it been with the health sector of Enugu State?
So I want to say that we started with a lot of things on ground, and we saw that we needed to align what we want to do with the intention and the pragmatic view of His Excellency, the exponential thinking mindset that he has, and what we can call leapfrogging technology. So taking the grassroots health down to what is current at the world standard. So when you look at that, you now look at where are you starting from. We look at it that we want to go to a place that is far into the global standard, but what we have on ground is not near it at all. I mean, so that gives us a lot of challenge. We needed to go back in the first few months. We needed to see challenges that some and a couple of other health challenges. Some of our health institutions are not functional. So we took on that, and we see that we needed a robust team, and His Excellency had the wisdom to be able to put up a robust team. So, and then we jumped into it. Right now, we are going on with the primary health care. Right now, we're also going on with accreditation of all our medical, nursing, primary health care institutions. We are also going on with revamping our dental hospitals that have been moribund for many years. We're also going on with a lot of education for our health professionals, and we're also working towards the reversing the Japa syndrome. Those were the things we met on ground. So it's been challenging, but the thing that is sure is that Enugu State is in the hands of a competent hand and someone who is committed to changing the face of healthcare in Enugu State.
Doc, you have analyzed how it has been in very few words, but impactful words, really. Let's take these things one step at a time. First will be the very, very amazing plan of the state government to establish what is called Type 2 hospital. Most of us have not heard any terminology like that before now. We didn't know that these hospitals are in types. Okay, so now I don't know how far that project has gone, if it is on, if it is in phases. How is it?
Okay, so let me just explain a few things regarding classing those hospitals. The first basic line of healthcare is the primary healthcare, and WHO defined it as essential healthcare, and that is based on scientifically sound and practically acceptable technology that the people can relate with and they can maintain in the spirit of self-reliance and determination. So at that level, people should be able to walk to the primary healthcare center for simple malaria, simple cough, simple thing that is not complicated. So our intention is to provide those in every ward. The ones that are not functional, we revive them. The ones that are non-existing, being built. So currently, there is a project going on at the primary healthcare level where those 260 type 2 primary healthcare centers are being built. What does it contain? It has everything that you need. There will be power supply, there will be water, there will be solar, there will be all the equipment that they need to attend to emergencies, to attend to pregnant women who may fall into labor in the night. There will be also internet and accommodation for the doctors, the the healthcare givers there, the midwife and the community health extension workers. So that is the type 2 primary healthcare centers. And we know that 3 things affects primary healthcare. It is accessibility, affordability, and availability. So the administration of Barrister Peter Mbah is making it first available within your ward. You should be able to walk towards your ward and just access healthcare. Then it's also making it accessible. So there is the road. You can see that road construction is going on. So that you can go there. The taxi man can carry the pregnant woman in the keke and move there in the night. Accessible. Then the third is affordability. That is one key thing that His Excellency is doing. So right now we are doing it in phases. Right now the first set is already being going on, and supervision is going on with it, and then the next phase is going to be launched in the next few weeks. So within the next 18 months thereabout, we want to complete the 260 and make it functional. How about empowering the provision of human resource? That's why we're also doing massive accreditation of our schools, so that we're not just producing places where people are going to have healthcare. We're also producing in mass the healthcare professionals that will work over there. So that's how far we've gone so far. And it's being not just giving out the contract, is being supervised, is being monitored per phases, and it's being built. So that when His Excellency leaves office, we are not having a dilapidated building that was completed 4 years ago. We want something that can last long, that can stand the test of time.
Yeah. All right, thank you so much. I mean, a lot seems to be going on as far as the healthcare sector is concerned. About 260 wards and then 260 hospitals. Yes, you are also resurrecting the dead ones.
Yes.
All right, so what about the doctors? Are there doctors that can be posted to these environments? Are there payments? I'm talking about the fact that doctors seem to be leaving Nigeria every other time. The ratio, talking about the ratio from doctor to patients. I don't know if you have done something about, or if you're putting plans in place to ensure that there are doctors, at least more than one, more than two in each wards. All right, so what are you doing to ensure that these professionals are taken care of so much that they are willing to stay in these wards?
Thank you so much. The in quotes, Japa syndrome, which is ravaging every part of sub-Saharan Africa, not just Nigeria, is huge, and it is multifactorial. So the solution to it will also be multi-pronged, and that is what His Excellency Barrister Peter Mbah is doing. Number one is that we are interfacing with the doctors that are currently on ground. For the first time, there is what they call the medical MRTF, Medical Residency Training Fund, that is being given to doctors every year for them to improve their skills, and all that is a fund, that is the government gives them, federal government gives them. Very few states are doing it. For the first time, within the first 6 months of His Excellencies, he approved and it was disbursed to them. So that's to encourage them, because really, when you have people working, You have to make them happy. You have to provide good working environment. So that's the first one I can mention. Then the second thing is the fact that we are providing enabling environment. We saw that those infrastructures, they are not optimal enough. It's not challenging their skills. It's not making them to be. We want to do better. We are putting that in place. In a short while, we're going to have a facility that is actually, the process is actually ongoing, that we have the best of the best, that you can do every special, that we won't need to transfer anybody outside this state for any specialty care, and it will be the landmark in. So it's not that we are in the process, and we are working day and night to make it happen. Then the other thing is about their salaries. We know that generally, economy has beaten deep into the inflation has been deep into what the people earn, and you could see that even some people are still earning what they were earning, like when maybe the forex rate was still very reasonable compared to now. So it doesn't measure. We don't want that, and we are working tooth and nail to make sure that this also commensurates with the increment in their own salary. The process is ongoing. We are giving everybody the audience to see that these are the things we could do now, and in our own way, we're also trying to see that how can we recruit more doctors. For the first time, His Excellency gave a blanket approval that for every doctor that leaves the government, the management of the health sector should replace without delay. I mean, that's one, because if somebody leaves a department and there are 5 of them there, 3 are left, and 2 are still the one working, the efficiency drops. But His Excellency gives that approval to make sure that this is happening. Now, one of the things that I will mention here, when people were complaining that okay, the request from the labor that minimum wage should be a particular amount, His Excellency, I was surprised when he said that. I was wondering why people are complaining that this is too much. And at the end of the day, look at that amount. By the time they buy fuel, by the time they do this, that what we need to look at is how can we create more resources. We shouldn't be narrow-minded. We should look at how we can create more resources to meet the needs and the welfare of these people. And that's our thinking. The public may not see it at the beginning, but that is what is being happening behind the scene. And the things you can see behind outside is the fact that it's reflecting in our relationship with the doctors, is reflecting in our revamping some of those facilities that we have on ground.
Doc, at the inception of this government, I am not sure if you've taken office by then or not, but there were agitations from Parkland doctors. You know the Parkland, right?
Yes.
Okay, so there were agitations. I think it was bordered around welfare. So they were threatening strike, but after a while, it was resolved. We didn't get to hear anything. They didn't embark on any form of protest or strike, and they are still working. How? I don't know. How was that resolved? What happened actually?
The major challenge is they came up, and they came up with very, very, very tenable requests that are obvious. And at that time, I was at the center of it with the dynamic CMD of Barclay, as well as Honorable Commissioner for Health. So we engaged them, we listened to them. The request they made, number one, they said there are challenges within the hospital, security were not there. Right there, His Excellency gave approval. We should inform the CSO to send security to the facility. And today, you will see that there is always a security team in front of that teaching hospital. Mm-hmm. Secondly, they said that the number of doctors are depleting and they are not able to employ. Right now, we've done 2 phases of employment within the space, including the resident doctors, including the doctors, including other departments. So then the third was that funds that they requested for their training, we got the approval straight and it was paid. We followed it up to the point that we didn't allow office bureaucracies and all that to delay it, and it was done on time. That was why the public did not see any strike. Yeah. We also had something like that in the nursing department. Few days ago, His Excellency approved the 100% approval of one of their allowances and all that. I mean, he has a listening here, and when he says he's going to do it, he get it done on the spot. So that's why you have not seen some of those crises. And of course, we, his men that he sent out, we don't also allow anything to stay. If we hear it, we jump on it, we ask him what do we do, he gives us the order, and then we act immediately. That's what we do.
That's great. There is something bothering us. No, I mean, not just me, it's bothering us as a people. The major people who produce drugs seems to have left Nigeria, making healthcare very expensive. Are there plans to bring companies or to train people to manufacture good drugs here in Enugu State? Because as much as you would want to make healthcare affordable for the people of Enugu State, if you're importing, they may not have a choice but to pay way higher than they used to pay. So it's still expensive. So drug production is something that we need to actually look at this point. Is this something that you've thought about? Are there plans towards that?
Thank you so much. One thing I need to emphasize here is that His Excellency is, yes, we are a part of the nation, but he's thinking more of subnational, where the image and the quality of life and everything about the state will be thought of as subnational. That each of all the parameters that I can use to judge will be unique and stand out. Now, regarding those drug people that the pharmaceutical companies that left,
yes,
we do not have direct power over that. But what we are doing is to see how we can control the drugs that comes into the state. We can control it in terms of price, we can control it in terms of quality, and that's why we are going on with a partnership with the Global Global Trust Fund, that to establish a central medical store, and it's almost done. And yesterday, I mean, it's one of the places that we have visited in the last few weeks. It's set, the cooling system is about to come in, and all those facilities are already in place. What that would do is that all drugs that comes into this state will be tested before it's being sent out.
Where is it located?
It's just behind Parkley.
Behind Parkley?
Yes. It's
all
a
right.
big ash-colored building with a nice compound and all. And each pharmaceutical shop can go there to buy drugs at the rate they will go and buy it in Lagos. That will help. That will do a lot. It will unify the drugs that, so this person is taking the same paracetamol like this person is taking, and then if there are problems, we can easily track it and know exactly what is causing the problem in terms of drug consumption in the state. We know a lot of drugs are not drugs, they are poisons, and we are able to control that. And we also able, in that team, we also have drug awareness campaign where the public will be told on this, the less chemical in your body, the better.
Yes.
Most people immediately have a headache, flagyl, tetracycline, malaria. So you know that kind of thing. We want to move away from that. We want our people to be educated and take informed decision in taking drugs, because health is a vital resource in the race of life. When health is challenged, every other thing loses value. And that's why they say health is wealth.
And this place you talked about, individuals can actually go there to buy drugs. It doesn't have to be a body.
This is how it works. Individuals cannot go there.
Okay.
But the point is that the shops where you are buying drugs, that's where they will be collecting their drugs. So it will regulate, it will almost unify the cost of buying drugs everywhere in Enugu State. And it also help our primary healthcare centers, our general hospitals, our state hospitals, our tertiary institutions. We now be getting their drugs directly from there, not individual supply that will be carrying it on the bike. We'll have, it will also generate jobs for people, because there will be dispatchers. And then we'll also be able to see, oh, this drug is going down, we'll be able to monitor it. And we'll be able to collect data in how many paracetamols do we need in Enugu State? How many anti-malarials do we need in Enugu State? And also help us to plan for the future. So the idea is unique, is forward-thinking idea that we're bringing into the health system in Enugu State.
Dr. Jaye, I like the fact that our people are directly dressed. Okay, this is not a matter of the elite. We're talking to everyone. I like the fact that he brought up that terminology. It's our own. We own it with our full chest. Then you bring in every other tablet to treat what you're not even. Most of us do not pass through diagnosis, and then we are sure we had malaria, and we're treating malaria at every sign of symptom of fever. Okay, it's also a beautiful thing that for the health sector it's all encompassing. You're not looking at one and leaving out the other. At this point, I'd like to open our phone line so that our listener on radio will call in on the show and ask you some questions or make comments or observation. The numbers to call are 0907 275 9950, 0907 275 9950, or you call 0706 815 8029, 0706 815 8029. We are still right in the studio with Dr. Yomi Jaye, the Special Advisor on Health to the Governor of Enugu State. Let's talk to this caller. Good morning. Thanks for joining us, sir.
I want to say congratulations to the Governor of Enugu State.
Please, can we meet you, sir?
And I am speaking with Chief Mbah.
You're welcome, Kichu.
Governor did very well. I completely think the governor is trying to rectify multiple things in his state that was not done right.
Ketchukumba, I'd like you to call us again while we are still right here on the show. We have less than 30 minutes to do this. The numbers to call are 0907 275 9950 or 0706 815 8029. Back to the hospital issue, Doctor. You mentioned revamping of the dental hospital. Is there an Enugu State-owned dental hospital?
That is very surprising. And you are from Enugu State?
Yeah, I'm from Enugu State.
And sorry for asking this on radio. Well, how long have you lived in Enugu State?
My whole life.
The whole life. So I'm just going to suggest that a minimum of 3-4 decades. You know what I mean?
Yeah.
And she doesn't.
It's up to that. So.
Yes. So and
please, can I talk to this caller?
Okay,
before?
please.
Good morning.
Hello, good morning.
Thanks for joining us.
Thank you very much. I'm Sanitarian Adrian.
Welcome, Adrian.
Yes, I'm a doctor from mental health.
Oh, thanks for joining us.
Yeah, this means to thank your guest there, Dr. Jaye, who is related to the, I'm sorry, technology, who is related to the government in terms of health. So, and based on, I'm listening attentively to all you said about health, what the governor is doing, and even beyond. So I appreciate the governor and the team so well for the effort that the key work that we do, especially in the health sector. So that's my question really is, the doctor there started with the establishment of the 260 primary healthcare centers across all the 260 hospitals towards the state. Now, I'm a primary healthcare worker and I'm a specialist in a matter of fact. So what I want to ask now is, what effort are they making to involve the environmental health officer and one of the core primary health care and resource person in every environment? Because like I am speaking now, a lot of activities about environmental health? No. I said that in the rest of primary health care, the primary health care and that's environmental health. So I would like him to throw light on what should be the state of environmental health officer in the state. Make sure that the support the government in improving the sanity, the health standard of the Enugu State.
All right.
Thank you so much.
Thank you very much, Edwin, for calling us. He will react to your concern in a short while. 0907 275 9950 or 0706 815 8029. I don't know which you're taking first, the previous question or the concern he just raised.
So I'll close out with this concern,
Okay.
and it will just help me to portray on something that is on your note. Now, we said
That's nice. Spoke.
yeah. So that's we said the primary health care centers are being built, and of course there is equipping and staffing of those facilities. Now, we are not just stopping at a midwife should be there, maybe a doctor or something should be there. We are also is an all-encompassing, and that is why you could see that we engaged the registrar of Nigerian medical laboratory scientists. We are engaging each one of them to see how we can help accredit our schools that produces these people right now. So you can go to the place maybe tomorrow, tell them that you are from ESB, that you have gotten approval from His Excellency through the special advisor. They should whiten your teeth for you. Free of charge.
You
go
see
there.
that? I'm going to call you.
So very soon, you are
you.
able to do your braces. Very soon you are able to. You won't go and be paying huge amounts of money.
Yeah.
Very soon you are going to. You ladies, you want to look good all the time.
Yeah.
You're going to whiten your teeth. You're going to do scaling and polishing,
Scaling and
among
polishing.
other things
Most
that
important.
that
I
we
can't wait
that
to
we
get to
have.
that point.
So I must say that Barrister Peter Mbah is one of the best governors that you can have at this time. And I think I'm not saying that by mouth. I mean, with good relationship over time, I know if he says he's going to deliver,
It's going to deliver. All right.
Now,
When we are working
let's go
on-
back
Okay,
to
okay.
the hospitals
Okay.
more. Okay, first of all, I hope we have covered all the institutions. I mean, the training institutions, health training institutions.
Yeah,
Have
okay,
we-
so I think I need to mention some people. Maybe we mentioned that, okay, you have mentioned nurses, doctors, and all. What about the community health, College of Health Technology? College of Health. Right now, there is one College of Health Technology, is the first in the southeast. Is Oji River. Is at Oji River. Undi Oji. Madu neighbor, yeah. So that's I greet all the people from Oji River that are greeted that are listening to this broadcast. This program. His Excellency has sent a team, pragmatic team that works, that acts on point, to go and assess the needs in that place, and of course to go and begin to do a revamp. Another school of nursing will be emerging from that place in a short while. Yes. So what we did was that I didn't mention this. Our school of nursing was at school of nursing level, and we were on the verge of being lost, as in losing out. So that the Nigerian Nursing Council wanted to shut down all schools of nursing in the state because they told us to do some things and upgrade to college. Within 2-3 weeks, His Excellency approved that they should upgrade it to college, and we provided everything. Right now, buildings are going on in different places, and it has been upgraded to college that has 2 campuses. One will be inside Parkland. 2 is at Ogu. Then he said we should add another 2, which will be at Unsuka and Oji River. So these are the things that are being done. So each one can produce a number of nurses every year, and then we can come up and say that exactly what we promised we have delivered. So that's about the accreditation. And for the first time, the accreditation team said that this is the first time the government presence is with them when they are doing accreditation. When they are going for accreditation, they just go and meet our school and then talk to them, tell them you didn't do well. But I always stay with them. That His Excellency said is with them, and whatever we need to put in place for them to give us accreditation, it should be done. And always, all the time, we'll always get it.
All right. While we are conversing for doctors and nurses to be treated better so that they can actually stay, I never knew I would have a reason to bring this up about their attitude to work. There are reports of nurses maltreating patients. In fact, to the point that people have the opinion that nurses are wicked people. Do you understand? So while we are also trying to see how they can be, better.
Okay.
What are you doing to ensure that they do the job?
Okay, so character is king, and you will see that clearly in the image that His Excellency portrayed. Character is king, and one of the things that we take very important is personal development for the staff. Not just, I used to say this, work more on yourself than you do on your job. If you work on your job, you will earn a living. If you work on yourself, you will earn a fortune. And so what we do is that there is a robust personal development character, how you shake, how you talk to the patient, how you talk to their relatives, how you treat them, how you give them the medication, how you assess them, all those things, they are in place. And we are starting it, it's a long-term thing.
Yes.
Old habits die hard, right? So it's a long-term thing. So from our whole team, first thing, how you appear. You can see the doctors here, the team that came with me. See, you can't appear less than this anytime. Morning, afternoon, night. You have to appear well. Not that you wear slippers and be going and think because you are a doctor. You need to appear well. Not so. Then you need to talk well to the people. So we start from our small team, and you will see it infiltrating into others across the system. We, the health team, the commissioner, the executive secretary of all those agencies, and the chairman of all those agencies, we are working together to say that personal development is very key. And apart from that, we want to be mold teams. You also have to take care of them. Some agencies, I told them, create a small place. Don't let them eat in the office like as you are doing now. Because they are not seeing you. You can quickly carry loi and use it. They are not seeing you. That kind. And then people will come in and be smelling yama yama. You go to consulting room, you now see somebody. You just finish one more cross. So everything is just yama yama. No. We want. So I said, create a small place in your office, any of your agencies. Create a small place where people, that's food area. In my private sector life, I dare not spend guguru or granite in the office. No, this is office. So we create a corner. When we just have a small place, we created a corner. That's where we eat. So that culture, we are putting it up in the health system.
Okay, our time is spent, but Dr. Jaye, I won't let you leave without talking about something that we thought was federal stuff, and that is health insurance scheme. Please, can you take 1 minute to talk to our listener about that? Just 1 minute.
So, thank you, because I have forgotten that. I didn't mention that. Well, you see, we have an agency called Enugu State Universal Health Coverage. That is our own health insurance. And we have the privilege of having a sound and experienced person in that office, Dr. Edith Okoro. There is health insurance. That is what they use globally for you pay small and access huge health care. I know people are reluctant because the health system, if you pay, I pay 10,000. Now I will go to the health center. They cannot give me anything. That's why we are working with the infrastructure, working with the people, making sure that their facilities are good. So what we need to talk to the public is that, we will come. Very soon we're going to flag off the campaign. I spoke with the executive secretary a few days ago, and we are ready to flag it or explain to you why this is. And we also want to make sure that the people outside the country who have parents here, the money that you are using to buy credit for 1 year, for 1 month, can treat maybe 100 people. You can say, oh, in my community, like His Excellency is paying for 1,000 people in his community. Not when he's in government, before May 29, he's been doing that. So if each one of us do that, the reason is this: contribution like that, you may not need cesarean section. This person may need cesarean section. Your whole money that they did not use, it will be in a pool, and then we can use it to help people who do not have. So that is and then the federal government will also be able to contribute their own quota to the health of the people. I want to encourage the public that when we flag off, we will do it, we will come to your different localities, make jingles, educate you, and also do some medical outreach for people, free medical outreach, and use it to promote this. Let's buy into this health insurance. Because if we build infrastructure, we have the people, we have the good health care, and we do not have money to fund it, it will not work. But I know that in the Enugu are good people. They want this to work. And you have shown your love to His Excellency Barrister Peter Mbah over the few months that we have been here. And he is 100% committed to making sure that your health is number one on his table. He doesn't joke with his health.
Your health is number one on his table. I like to feel healthy. Okay, that actually makes me feel healthy. Dr. Yomi Jaye, the Special Advisor on Health to Enugu State Governor. We appreciate your very resourceful contribution on our program this morning and your presence, time spent with us as well. Thank you very much. While we are celebrating Governor Peter Mbah's 4th anniversary, our special focus was on Enugu health sector. Thank you, dear listener, for joining the conversation, and to all the callers, we appreciate you as well. We're signing off to take a very important message, so stay tuned and listen before we bring you Sunrise Sports and sign off on our breakfast show this morning. Good morning, Cold City. My name is Mbah.
My name